Farmers aren't the problem. People who eat aren't the problem. It's very clearly what they have access to. That's what the barrier is here.
We live in a really low-income area, so when people are at the grocery store shopping, one of the first things that they compromise on is fresh produce and fresh fruits. Especially if the quality isn't there in the grocery store, it's understandable that people aren't willing to split with those dollars for produce that's going to last 2 days. Tractor was originally created by farmers for farmers.
We've been with Tractor since near the beginning, but it was just little stuff at the start. And then COVID year, I think, is when we really ramped it up.
Tractor's always been like a farmer first organization.
So much of what we do as an organization is creating community.
They've never given pushback on a price that I'm like, this is what it is, this is the size. But that dialogue is always open if it needs to be. It's a game changer for sure. I wish all communities had that opportunity.
Because we work so closely with farmers, we ask the community what they want, whether they're a restaurant, SNAP customer, clinical referral, Medicaid, paying customer, whatever they are. Within 72 hours of harvest, our product is like reaching the consumer.
So our clients and our customers get to engage with our farmers get to engage with each other.
We love this, you get a lot of thanks, and that's what keeps you going throughout the week. You're like, I'm doing this and people appreciate it.
The older generation is helping the younger generation with technique, whereas the younger generation helps the older generation with bookkeeping, new technologies.
There's a lot of aspects of this food that you cannot put a price tag on. We have a referral process where a physician can say, this is my client and they're diabetic and they could really benefit from a fresh diet. We would basically build a profile and a relationship with this individual like any other customer and say, what do you like, what do you not like? So we feel connected to the clinical space in that we are research and development for that in food.
What's the middle ground between the health industry and agriculture? Mm-hmm. If we're going to start talking about food as medicine, this has to have a value in it.
Yeah.
And that's what we're advocating for, and feel like we're being heard.
It meant a lot to Tractor to be part of the Extra Miles tour. Blue Cross Blue Shield in North Carolina was able to provide us with a refrigerated truck that doubled our capacity to reach folks in our community seeking healthy food. It's rare to find a partner that can be so in step with your values. We're grateful that they can make food and farming a part of it.